All right, so when you get started, you're gonna have your gloves out. So remember that these are not ambidextrous, they're left and right specific, and they're size, so they're gonna have a better fit. So you'll have less hand fatigue, okay? These are nitrile, we've pretty much gone latex free in here, that way we don't have the chance of any allergies, okay? So before you start, you wanna make sure you open this up. Now, I can't touch the inside here because that's sterile, okay? So I'm just gonna open that up and leave it right here on the counter. And then this is your package. It tells you right on here that it is 4% chlorhexidine, has a surgical scrub, brush, and sponge. So everything that you need is in here, okay? So I'm gonna open this up. And put that right there. So I'm gonna wet my hands first. Now our soap and our nail brush are all in one. So I'm gonna grab my soap first, and I'm gonna just kind of lather up my hands to start. Okay, so bless you. And then I'm going to grab the nail brush. And we're gonna go underneath each nail. I missed my foot activated sync at this part. Okay, once you're done with that, you can just drop it in the sink. I'm then gonna take my scrub brush, and you're gonna scrub each finger individually, each side. So remember, this should take you about 7 minutes. So in theory, you probably go about 10 swipes each area, okay? I just thought that Santa was someone in the doorway. So for the pass off, you can tell us that this should take you about 7 minutes, okay? So you're getting in between the fingers. Each side, again, roughly, would be like 10 swipes.
7 minutes the entire time.
7 minutes for the entire wash. You have a scrub brush and you have a sponge. Okay, you're gonna go to your wrist. You can wet it if it starts to dry up a little bit. You're gonna get your wrist. And then up to the forearm and elbow. Now, once you go to the forearm and the elbow, you shouldn't really go back to the fingers, okay? Okay, when you're done, you can drop that in the sink. Now, when you're rinsing, you want to make sure you're keeping your hands directed up so that the water coming off my elbow region does not go back onto my hands. Okay, so you're going to keep your hands in this. Oh, the sink is fun. We used to have foot control before they redid the lab. All right, and then there's probably going to be a surgical scrub tech that's going to help you, so she's going to give us, thank you, a disposable sterile towel. Now, once I dry my fingers and I go down my arm, I cannot go back, okay? I'm gonna use another side of the towel. So probably best you just do both hands first, and then go down wrist and arm. A lot of times if you were doing this, like if you were going to the OR, you wouldn't have anything underneath, so I would just have my scrub shirt. But since I do, I'm gonna use this to pull it down.
Would you use one towel for both hands?
You can, yeah. And the scrub cap, this would go right in the bin, is waiting. So now I can't touch anything with my hands because I'll contaminate my hands with our coat, sterile coat. So I'm gonna keep my hands in here. And I would already have my mask and shield on because I couldn't touch that after, right? So I already have that all ready to go.
For the pass-off, do you want us to have the shield too?
What's that?
For the pass-off, do you want us to have the shield too?
Sure. Okay, so we're all tied, so now I'm gonna go over to our gloves, okay? Now, I can't touch the outside because that's not sterile, but I can touch in here. So I'm gonna open this up and just touch on the inside. It tells me left and right. I'm gonna go right in this little cuff and I'm gonna pull to open. Now, your textbook says you should put your dominant hand on first. So for me, I'm a righty. So I can touch on the outside because this is the inside of the glove because it's cuffed, okay? So I'm gonna put my dominant hand in, touching the inside of the glove only, sorry. Okay, now I can't touch here to adjust that yet because I would contaminate these gloves, no longer sterile, okay? So now I'm going to go underneath the cuff and put my non-dominant hand in and pull that up. Now I can fix this, okay? Now at this point, I am sterile. So I can't touch myself, I can't go touching things, so you should pretty much just stand like this at this point, and you'd go wait over by the patient, okay? If you work in a place where you're gonna go into the OR to do the surgery, they will be watching you like a hawk to make sure that you do not contaminate anything, okay? So easiest thing to do is just stand like this so they know you're not touching anything, okay? And then you can start working on your patient once you're told that you can do so, okay? When you are doffing this PPE, you're going to do it the same way you did before. You're gonna pull in the center of the palm, turn it inside out, go underneath here, put that right in the trash. And then if you have the disposable type like this, you would just pretty much rip it off, okay? But you remove this. They do have some that are reusable and that are laundered. So you would take that off and it would go into the laundry bin, okay? And then you would wash your hands or alcohol hand rub. This would get discarded. Mask would come off in normal times. And then you would alcohol hand rub or wash your hands, okay? Any questions?